10 to 10 helpline is a new resource. It's confidential, it's free, it operates from 10 a.m. to 10 p.m., hence the 10 to 10. People can call it if they have been abusive towards their partners and they want to change. If they're worried about their behavior and they're not sure it's in the category of controlling and abusive and they want some advice, someone to talk to. Or if you've got a friend and family member and you don't like the way they're treating their partner and you want some advice about how to approach it. It's also there for professionals, therapists, or substance use counselors who want to talk through how to integrate addressing intimate partner violence in their ongoing treatment.
Change is hard, but we can do hard things. And you can call the helpline, and there are wonderful folks who will take those steps with you.
I'm Peter Willett. I'm a physical therapist here at Bay State Wing Hospital.
Hi, I'm Sue Mondor. I'm a physical therapist assistant.
We're currently both serving as PPE coaches supporting the inpatient area here at Wing Hospital. Consider getting vaccinated. It is so important. We are seeing more and more sick patients come into the hospital that aren't vaccinated. It's the best thing you can do.
Hi, my name is Ashley. I work here at Wing at the Eastern Region. Please wear your mask when you're out in public.
The state of DV in the rural areas of the Quaboag Hills during the pandemic has seen a lot of isolation for our clientele. If they are isolated at home with their perpetrators of abuse, then there's no safe space to make contact with our advocates. Since the pandemic has eased a bit, we're seeing more and more contact because they're able to leave the home. Many of our low-income clients lack the access to housing. How do you leave your perpetrator if there's no housing units in our area for them to go? So our clients, our low-income clients especially, can't leave because there's nowhere to go or they cannot afford where they go. Helping the local towns figure out how to produce more housing units that people can access and get a safe place to go would be great. We saw a rise in restraining orders not granted, especially at the height of the pandemic, because there was no place to send perpetrators. So the judges were reluctant to grant and remove this person from the home. That has since changed, but it's still a factor. One of the other barriers that we see is the lack of employment in the social service agencies that are local. Social service agencies not having employees is causing more problems for our survivors.
Hello, I'm John Zenowich, the Executive Director of the Ware Council on Aging. I guess what I'd like to bring up is sort of the state of seniors here and Ware that we're coming in contact with and some of the concerns that they have. First and foremost on our mind, of course, is the isolation that they've experienced over the last couple of years with the pandemic and COVID being what it is, and everybody else has gone through that as well. But we haven't been able to do as much outreach as we'd like to. And we don't know what we're going to find when we do. People have been sort of isolated from their friends, their families, their social activities, and getting out into people's homes is going to be difficult. And we don't know what we're going to find when we get there. We already have had some incidences of hoarding issues, some decline in mental capacity. And so we're really concerned about the state of mental health and the ability to properly assess and treat mental health going forward, especially in our seniors. Onset of dementia, Alzheimer's, things like that are going to be a big priority for us moving forward. So we want to make sure that the resources are available at all levels to be able to take care of our seniors properly. Also, we're having issues with housing. Senior housing, affordable, low-income senior housing is a problem in this particular area. We have been seeing a large uptick in requests for and applications for senior housing in and around the Ware area. And we know that there's a long waiting list for people that are looking for available apartments. People that are trying to either downsize from houses into apartments, or people that have recently become homeless. So we are very concerned about the housing market here in Ware. And lastly, and not least, is we're very concerned about the community health in general. As a couple of seniors came up to me the other day and brought up the fact that they use community health centers for their health, vision, and dental needs because it fits into their budgets. As low-income, fixed-income seniors, they have to be very careful with how much money they spend on their health in general. And so they end up driving as much as 45 minutes away in order to be able to get their services. So when you look at it and you do a simple Google map search and you see community health centers near me, and you see that they're in Gardner, Fitchburg, Athol, Worcester, Springfield, Chicopee, Northampton, and it makes a giant rectangle all around the Quaboag Hills region. And of course, there's a giant hole right in the middle where Ware sits. Community health is an important problem, and that needs to be addressed. It'd be greatly appreciated from the seniors at Ware. Thank you, and have a great day.
I'm working here at the Ware Family Resource Center. We opened a year ago, July, during COVID, and we're here to support families and get them connected to resources that they're looking for. It's actually a diversion program to keep youth from entering into the court system. So we've lost our clinician because she's gone on to bigger and better things, and we're having a hard time currently filling the position because everybody's short all over the place. Currently, the school systems are reaching out to us and the district attorney's office is reaching out to us. They'd really like to see us getting groups back together for the youth that's out in the community because they're struggling socially and emotionally. We need to get these groups back together so that these kids can be together and figure it out. We want to help them as best we can.
Hi, I'm Debbie Ennis. Thank you very much for having me here. I am a local social worker. I have my own business. I've been in business for myself for 20 plus years. I am seeing a huge crisis right now that people may not be familiar with or recognizing. I'm getting 5 to 7 referrals a week. I'm not kidding you. It's coming in from all over. People don't realize that kids get their socialization from school. When COVID shut everything down, they lost it for about, I would say 18 months, at least maybe 2 years. They've lost it. They were isolated at home, and they're isolated with adults who are dealing with all of this. So their mental health needs weren't really being met. People don't realize, and social workers very much realize, we are social creatures. We need socialization. I typically work with teens. I have about 60% of my practice is teens. Right now, it's hovering about 80%. More and more teens are needing assistance. The funny thing is I have a lot of teens who are self-proclaimed introverts. They like being at home, but they're starting to not feel as good. They're starting to feel a little depressed. They're not sleeping well, that kind of thing. And what I'm saying to them is, because you're not being out with your friends. That is it. Kids have, social anxieties about being with other kids. So they tend to keep back and they think they're introverts and they want to be here. No, it's just typical teenage anxiety about being with other people. When we're forcing them to go to school, they don't realize this, they're practicing being with their peers and what to say and how to say it and be a little embarrassed, but realize it's not the end of the world. Now they're not talking to anybody, video stuff. This does not make up for social interactions. They're getting depressed, they're getting sad, they're not eating. The amount of cutting, eating disorders, depression, anxiety has always been pretty high. Right now, anxiety is through the roof, really hitting teens hard. So what is the solution to all of this? And there's a couple I could think of. Place social workers in school systems. You cannot find social workers right now. There's nobody available. Some people have the idea of adjustment counselors, guidance counselors, but you need a social worker, and not just one for a full school district. So if they can get some money for that, that would be great. So someone was suggesting to me tuition reimbursement for graduate students, breaks on their loans. You place social workers in school systems, and then they'd be able to get tuition reimbursement for being in that school system. That would help put social workers in the school district. They would be more incentivized to be there. If we're going to be putting social workers in schools, high schools, really important. 7th through 12th grade is very, very important as well. We really got to give the students what they need to not just survive life. You want to live life. So let's give them the tools that they need so they can live life.